Hello, I'm Dr. Tess Mauricio. We should all be beautiful inside and out.
The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. When it comes to beauty, they say she's the best. But who is this woman they call Dr. Tess in your know? The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show.
This is the Dr. Tess Show.
Hi, my name's Eleanor and I'm from Glendale, California. I want to see Dr. Tess because I've always had this blemishes like red marks and my acne marks from way back when I was in high school. Melasma is the damage that the sun's rays creates on your skin, so you have brown spots. My skin has always bothered me. I always envied people that had really fine textured skin. In the past I've seen other doctors and they've tried Cosmelan, they've tried a laser treatment on me. I've had peels and it has helped just a tiny bit, but there's really no substantial effect. So now I'm so excited to meet Dr. Tess. I think she's gonna be the one that's finally gonna fix this skin problem I've had for years. I can't wait to see her. I'm actually gonna seriously pick up the phone right now and get an appointment to see her.
There are a lot of people out there who have a very similar problem like Eleanor. She's gone through a lot of dermatologists, both in the States and in the Philippines, and what she really wants is just improvement in overall texture, and she had a few things going on. Eleanor, you've been suffering a lot with your skin, different issues, and I'm looking at you now, and there is a combination of different things going on. She had acne scars, she had growths on the skin, she had large oil glands we call sebaceous hyperplasia, and different doctors have been like burning it, lasering it, and then she also had some discoloration from sun damage, and she hasn't really been happy or even satisfied at all with any of the treatments. And when I looked at her, I said, okay, Eleanor, I think we're going to be able to really help you. Your skin, even after one treatment, is going to dramatically improve, and all of the things that are bugging you, and your search is over. It has to be diagnosed right. So now that you know there's sebaceous hyperplasia, we can treat them, because we'll be able to really address everything that you want with a treatment with fractional resurfacing, platelet-rich plasma, and then a little bit of cautery in the areas that we need to, and clean everything up. PRP, or platelet-rich plasma, is really one of the more popular treatments that we perform in our clinic. We actually use more PRP than anyone in Southern California, that I know for sure, but we use it in combination with a lot of the things that we offer patients. In Eleanor's case, it is resurfacing, and what it's going to do is, after we resurface her skin with radiofrequency and fractional radiofrequency, we are going to administer platelet-rich plasma, which is the part of our blood, or her blood, that actually contains growth factors, cytokines, all of the things that we need to heal and build collagen. What we find is that when we do this treatment, combination treatment, the patients not only heal faster, so you'll find that by tomorrow, if you wanted to, you can wear makeup. There's really very minimal, if any, redness or swelling. So after the resurfacing, we're going to apply the PRP on her skin, and it's going to act as a fertilizer, because what we want to do is collagen needs to be produced to smooth, tighten, and make her skin really amazing. We have the very best topical numbing cream. So that's the cream that Eleanor had on her skin before we started doing treatment, and it really numbs the skin so well that even when we're injecting, she really doesn't feel much of it. And of course, when she had the radio frequency treatment, she really didn't feel much of it, but she's totally awake. She doesn't have to go under general anesthesia, which obviously makes this procedure a lot safer. Now she said after this she's gonna go and watch a movie, and it's totally doable. There's not much redness, there's not much swelling, you know, with the technique that I use, patients don't even bruise, even with these injections of PRP under the skin. So she's ready to go. So what movie are you gonna watch?
I forgot.
That's gonna be a good one.
Is it?
That's it.
The Dr. Tess Show. The Dr. Tess.
I'm Jennifer, and I'm 58 years old. This was me a month ago. I could hardly look at myself in the mirror. This is me now. I didn't think it was possible, but I feel and I look great. And the best part is that I did it all without having surgery. It's as though I stepped into a time machine and I look 10 years younger. Thank you, Dr. Tess.
You're welcome, Jennifer. If you're like Jennifer and you want to look younger, call one of our M Beauty clinics near your area. Step into our time machine and we'll bring you back.
It's really important for me to look my best at all times, and Dr. Tess knows this. That's why she introduced me to Lifeline Skincare.
I found the most amazing technology. It is stem cell technology. These stem cells are not embryonic.
Usually a few days after using the cream, you start to see your skin becoming brighter.
And I've been getting a lot of compliments about how great my makeup looks, but I have to stop and tell them it's not my makeup, it's my skin. I got mine at mbeautyclinic.com. Get yours today.
I'm so blessed to have a successful career in show business and be a wife and a mother at the same time. After my second child, napansin ko na parang tumaba ako. And I'm so lucky to find the best, si Dr. Tess.
Women's bodies change after childbirth. It's almost impossible to get back in shape after having kids. Our Tickle Lipo procedure will get that body back.
Ladies, we can get our sexy back.
Dr. Tess, simply the best.
The Dr. Tess Show.
My name is Sherry. I'm from Torrance, California. I want to see Dr. Tess because of my stretch marks. Well, I was watching TV one time and I saw her at this show, The Doctors, and I did a research on her. I Googled her, and I think she's really good. Since I had 3 kids, since I had my first one 13 years ago, I've had stretch marks everywhere. So I want to at least not get rid of it, but at least diminish some of the bad parts. Well, I want to get rid of it because I actually want to wear a bathing suit or a 2-piece bathing suit, you know, like before. It's embarrassing, you know, you can't really go out, you can't wear, well, my frame is small, so I would want to wear something that I can wear before I had the stretch marks, you know, most especially the 2-piece when it's summertime or when I go on vacation.
Stretch marks is one of the biggest problems for women, especially obviously after childbirth, but stretch marks can also happen after a lot of weight gain and weight loss. In Sherry's case, she's had 3 kids. You wouldn't be able to tell. She's very, very sexy anyways, but you know that she told me she hasn't been comfortable enough or confident enough to wear a swimsuit or show off her abs, even though she's not, you know, fat at all. She's very slim because of her stretch marks, and she really thought that she just had to live with it for the rest of her life because she's gone to other doctors and they just say there's really no cure for stretch marks. But I'm telling you, ladies, there is, depending on what kind of stretch marks you have. And people at home who have stretch marks, the success of treatment is different. If you have the kind of stretch marks that are white against darker skin, there's still no technology that actually can put the pigment back. So we'll take a look if that's the kind that you have, but it sounds like it's not. Sounds like it, for you, it's not so much the color, but it's the texture that we really want to improve. So I'm going to just raise it, lift this up. Okay. All right. And you told me that it's this part here. And the good news for you is that the stretch marks that you have are basically, you know, there's no color change. They're not red, they're not lighter than your normal skin tone. So we will have a very, very good chance that we can rebuild collagen in the area that's loose and in the area that kind of has a different texture than your normal, here's your normal skin. If you can imagine, like I was saying to you earlier, stretch marks is almost similar, the easiest way to think about it, with aging and what happens with, as we get older, as the skin loses elasticity and it loses collagen. But of course, this was artificially created with your pregnancies.
Yes.
And a lot of people ask me, you know, was there anything that, you know, that you could have done to prevent this from happening?
Yes, because I did the butter, everything. I did everything, but I guess I got really big.
Right. Well, besides that, also I think most of it, which will make you feel better, and women out there who do have stretch marks, that a lot of it is really out of your control. Most of it is genetics. So, you know, like for me, for instance, my mom had 4 kids. Obviously, you know, everyone gains weight different, but she didn't develop stretch marks. So I had 2 kids and I don't have stretch marks. And there are women out there who actually will say they didn't even get that big, and they've used all of the creams and everything, and they still got stretch marks. So it's really a matter of how the skin is built, and it's genetics. So it's really not your fault.
So I should
Okay?
just blame my parents.
Yes, always blame your mom. I always blame your parents. We did a treatment on Sherry where, again, what we did is we combined resurfacing, platelet-rich plasma, and micropen technology to really help rebuild the collagen. Because if you look at a stretch mark, how does it look? It looks like the skin has lost its elasticity. It looks like the skin is thinner. And so if we're able to rebuild collagen, we can tighten the skin, restore elastin, restore collagen, and also the skin will blend in. So it's not like white areas, red areas, and then normal skin. And she was a little nervous because she thought the procedure was going to be painful.
I thought it was really going to hurt, but after the numbing cream, I guess it was already working. I was afraid that it wasn't going to work, but the first initial hit of the needle was kind of just, I was probably just anxious, but it was fine. It was great.
And I kept reassuring her, but she didn't believe it until she was done. And she's like, wow, it wasn't really bad.
The matrix, I really didn't feel anything. I didn't even know that she was doing that. It was ticklish, actually.
And considering that she had a lot of treatments in a single day, and that's really what we are experts in, is utilizing all of the amazing technologies available now, specifically for Filipino skin, to put them all together in a really wonderful protocol to give the patients the best results, but the least amount of pain.
The Dr. Tess Show. The Dr.
In this business, your face is your number 1 asset. It's the canvas for all your emotions. How's that for drama?
Hilda Cornell has one of the most beautiful faces in international cinema.
So you want to be sure your face is well taken care of. So I go to the best. I go to Dr. Tess.
We customize our treatments to your individual needs. Our time machine program can make you look 10 years younger in a natural way. It's super high tech and very economical.
Dr. Tess, simply the best.
Jeanette Abayari has really become an M Beauty believer and a Dr. Tess fan, I guess. I mean, she walks around in events wearing an I Heart Dr. Tess shirt, for God's sake. So she really has to be our new cover girl. I'm so happy because we were really able to help Jeanette with a lot of the problems that she's been facing for a long time.
My skin is so horrible. I go, this is a perfect time for my skin is so horrible right now.
When we helped her with her skin, she had really bad acne scars, eczema, dry skin, just the medical dermatology part of that, helping her with acne, hormonal acne, and that was done through a combination of acne laser treatment, photofacial treatments, and then of course treating her as a dermatologist with the right antibiotics and topical treatments. I'm also adjusting the setting, so if you're really sensitive, we can go lower. But if the higher energy you can use, the better.
I'm just gonna take it.
Yeah, exactly. You're here, you know what I mean? The other thing that we address for Anjanette are her acne scars and of course anti-aging. Why not? Anjanette is in her early 40s, but she is known for her beauty, and so we really wanted to just restore her to her youthful look. So we did the full time machine on Anjanette, which is a combination of fractional resurfacing, platelet-rich plasma, micropen, and it was fantastic.
I wasn't sure what to expect, actually. Like, I still had no idea going in, like, just laying down, because I don't know, it looked like it would hurt, but not really. And it didn't really. I mean, the numbing was perfect.
Now she doesn't break out as much anymore, so she doesn't have as much scars. She's a lot more confident. She's wearing a lot less makeup.
Oh, I'm really happy. I'm an adopted sister now, so I'm there all the time. I'm really glad that it's a non-invasive type of procedure. That there's no surgery or anything involved in it, and I like the fact that we're using my own plasma to rejuvenate my skin. My sister too actually said that. She's like, "You look younger for some reason." I go, "Yeah, maybe it's my hair, because I look younger with my hair this long." But yeah, I mean, there's a couple. My mom.
I think that was the first time where she became a really huge believer, because people kept telling her her skin was looking great.
I would recommend this to anyone and everyone who wants to take a couple years off their face to boost their self-esteem, all that. I think this is a great procedure for it.
While we're at it, she said, "Dr. Tess, do you repair earlobes?" And I said, "Yes." And she's like, "Yes." She was so happy because of the many years being in pageants. She was in pageants, when she was a teenager, and they used to wear really heavy earrings, and it really tore her earlobe. She showed it to me. I'm like, "Yes, that can be done," and she was so ecstatic. And so we set up the date to do it. It's all done under local anesthesia. We actually did it at the end of my clinic day, so we're doing her Anjanette's procedure. I numbed the area, and then it's sort of gruesome if you're not used to looking at the surgeries, but this is a true surgical procedure. It's not a joke. It's not a simple procedure. You have to go to someone who knows what they're doing, because your earlobes can really look crazy messed up if the doctor is not good. But anyways, the procedure itself, what I do is I restore the edges. So I cut off part of the old ear.
I just heard that.
You heard it?
Yeah.
Yeah, and then you have to refresh the edges. This is actually a very cool procedure. And then the two new edges I sew very finely and really meticulously, because we really want the edges to match. So we did both her ears. She wasn't in pain at all after the numbing medicine. Yeah, don't let anyone touch your earlobe.
Don't let just anyone touch anything of yours.
That is true.
Unless you they're like.
I don't know, especially the earlobe.
Yeah, but the earlobe's like one of the least looked at parts of your body.
No, but it's Yeah, but if it grows weird, it's
like worse than cauliflower.
It's gonna be good.
That'd be great.
Awesome. No more. It's
I'm
all
gonna
wrapped
if they
up.
ask me where I got my ears, I'm gonna say, "M Beauty Clinic."
That's right. Where'd you get your body? Where'd you get everything, huh?
That's right.
From head to toe.
Yeah, and we're like, okay, by episode, whatchamacallit? What do you mean I look different?
And then after a week, she came back. I removed the rest of the stitches, and her ears are looking really good. It will be about 2 to 4 weeks before she can put a new, she can pierce her ears, and then she'll be ready to wear her earrings again.
The Dr. Tess Show. The Dr.
I'm so blessed to have a successful career in show business and be a wife and a mother at the same time. After my second child, napansin ko na parang tumaba ako. And I'm so lucky to find the best, si Dr. Tess.
Women's bodies change after childbirth. It's almost impossible to get back in shape after having kids. Our tickle lipo procedure will get that body back.
Ladies, we can get our sexy back.
Dr. Tess, simply the best.
My first guest is America's favorite dermatologist, Dr. Tess Mauricio.
17 million people in the U.S. suffer from acne of all ages, and I've had acne my whole life.
Dr. Tess Mauricio is here with more on how to recover the younger you.
America's favorite dermatologist, Dr. Tess Mauricio, here with her very happy patient.
America's favorite dermatologist, Tess Mauricio, is
and here to debunk some common myths is dermatologist Dr. Tess Mauricio.
Hi, how are you? Welcome.
I tell everyone, I'm the one that came up with this brand name of America's favorite dermatologist, because when I met her, I'll never forget, she comes walking in, she was there with 3 other doctors, 3 other medical doctors, other dermatologists, but Tess was always a standout, not just because of her appearance, but this positive energy. She walks in, she's friendly to everyone. You always say you could judge people based on how they're friendly to the little people. The interns, the camera guys, she's smiling, she's happy, and right off the bat, she made me feel comfortable.
Nakita ko si Dr. Tess sa TV on the talk. I saw she's Filipina and she seemed very personable. She wants to help people feel good about themselves, and being a dermatologist, sabi niya, you could see it right away that when you help someone, they're so happy, and I think that's great that she can do that and she can make us feel better about ourselves.
Hi, it's Jessica Sanchez, and I'm here at M Beauty with Dr. Tess. I met Dr. Tess through a mutual friend, and she is amazing, and everything that she's done for me is amazing. She's just an amazing person, the kindest, and I'm so glad that she's my friend.
We can make your acne scars disappear to a point where acne will be just your little secret. It was a very exciting day at M Beauty in Glendale because we have a very special guest, and it's Marla Maples. Everyone was kind of blown away when they first saw Marla walk in the door.
Hi! No, perfect timing.
See you again.
You too, always a pleasure.
You guys are always doing something beautiful.
Hi, sweetheart. Sorry about the traffic.
Can you believe it took me over an hour to get from Beverly Hills?
That's crazy.
And I was on Waze, and I was on my GPS.
Because she was like a goddess of beauty and light, walking in, and she was just wearing a tank top and like a long skirt.
Marla Maples. I just feel honored to have met her. She's probably the most perfect human being that I've ever met in person. She's an angel in her heart, you could tell, and just by the way she looks and the way she moves, she's so graceful. Perfection incarnate is the only way I can describe her.
Hi, my name is Marla Maples, and I am here at M Beauty by Dr. Tess.
After we met that one time with Mark, we visited her house. She really felt very comfortable with me. She trusted me.
Well, Dr. Tess and I met through a mutual friend, and she's been at my house, and we did a few series of shoots there at my house, and I've just enjoyed getting to know her. So now I'm getting to see her beautiful facility here and learn more. I'm more of a preventive alternative medicine person, and I like really the healing from the inside out. And Dr. Tess has told me about the Venus Freeze. It seems like a very non-invasive type work to help stimulate the collagen.
She didn't want anything too invasive. Obviously, she doesn't believe in having plastic surgery and surgical procedures.
State of the art and beyond.
That's right. Okay.
Amazing.
There we go. Venus Freeze is an amazing technology. It's painless, it's relaxing, magnetic energy and radio frequency. Marla is now almost 50 years old. She's 49, turning into 50. And of course, she has issues about her skin. She wanted it to be tighter. She wanted it to be firmer. She was complaining about fine lines around her mouth, around the eyes. She was complaining about loose skin on the neck as well. How is it?
You're gonna make me want to take a snooze.
Yeah, do so. You need it. She's always so busy. She's actually filming for a TV show. She's filming with Oprah. She's filming for a movie. So we couldn't really do our time machine procedure on her on the very first visit, although she's very, very interested, and I think we'll convince her to do it when she has more downtime. So take a look. And
oh, wow.
You see it?
Oh my gosh.
The difference between...
I see it.
Right here, see?
Oh, I do.
She really saw the tightening and lifting on her face.
See, I see this here, this kind of deep, but I don't see it over here the same way. Well, I think I'm going to stick around, Dr. Tess. Awesome. I can think of a few other parts we could use this time.
You know, we're talking. That's the cool thing about Venus Freeze. You can use the same technology. It has a body applicator.
Oh,
and you can pick the body part that you want to work on, and we can work on it.
That was always my best asset, but it could need a little bit of like lifting and firming.
You know, why not? It's painless and it works. I reassured her that in a few days her skin will be even more beautiful, more even, and it'll require her to not need as much makeup, and she totally loved that.
If we can just perk our skin up, why not? We stay the same person on the inside, and we just tweak and stimulate our collagen on the outside. It sounds like a really good process to me.